Okay, so we are going to continue to do the last part of the human disease caused by bacteria. And first of all, some of you pointed out I should change this. This is examination 2, lecture 3, not the exam 3, lecture 3. So you can just change it by yourself. Okay, now I already imported, I think the two or three different type of the videos on the YouTube channel, and you can look which I draw a lot on the blackboard. Here I would do the same thing, go over the slides, so you can understand it. So here we talk about sexual transmitted disease. Now, sexual transmitted disease is a major issue, a public health issue in the whole world. Averagely, there are 300 million new cases every year. Now, mainly they caused by sexual activity, but they also could be transferred by non-sexual means. For example, if you do a blood donation, lots of things happen. The HIV virus of syphilis could be transferred from the blood. Okay, so and if the pregnant woman has been diagnosed with sexual transmitted disease, and the newborn baby will have sexual transmitted disease, for example, syphilis. So just to let you know, they could be non-sexual means. Now, they could be cured easily. Some of them are difficult or impossible to cure, and some of them even asymptom or be the carrier. Now, the most frequent is 50 to 30-year-old age group, but also lots of them are others are sexual activity person. Now, I'll write on the blackboard, there's 95% of the chance is male to female, and there is no vaccine for that. There is no memorable immune response, which means you had a syphilis. Does not mean when you get it once, you will be immune and you will never get a syphilis because it's not going to generate antibody. Okay, so sexual transmitted disease, this is always a debate in the clinical science area. Is that a science problem or it is a social problem? That's always have a good argument. So here we're going to introduce some of them, not all of them. This is first one is gonorrhea. Now this is a typical symptom for gonorrhea of male, which is a penis has a urethral discharge. You can see there is a pus generate. This is usually a dead white blood cell. We can get this sample and do the gram stain, do the cultivation, and diagnose gonorrhea. So what is gonorrhea? Gonorrhea is caused, we call the name is Neisseria gonorrhea. Now remember, it is the same species name, genus name with Neisseria meningitis. So the characteristics are very similar. This is gram-negative, coccobacillus, and the oxidase test positive. We will mention oxidase test in the lab section. Now, what happened is when you see on the slide, on the patient, the picture, always you will see, they will be packaged by the white blood cell. And you look at all these, that's Neisseria gonorrhea. What it looks like? Looks like it's a coffee bean shape. So we say it's gram-negative, also diplococcus cell, but coffee bean shape. That is Neisseria gonorrhea. Okay, it's phagocytosis by mucous cells, and it can be penetrated. It's very invasive. Now, you also should know that gonorrhea can be transferred from mother to child during birth. And what happened for the newborn baby? They will have a conjunctiveness of the eye, the skins. So when you see a newborn baby, the conjunctiveness does not mean they have eye disease. Possibly they have a gonorrhea, which is transmitted from the mom. Okay, so that's gonorrhea. Now, gonorrhea, what's the symptoms? The symptoms in male and the female is a little bit different. Basically, they both have the urethral discharge. For female, you have a vaginal discharge. After 7 to 21 days of infection, you have abdomen pain, burning urination, creaming pus. Also, for females, they may have abnormal period time. Now, what they do, I mentioned that there's a different level, different way to do the diagnosis and the testing. For male, we do the gram stain, we streak plating onto modified cyanomartin agar, and then we also do we also do a toxication test. But for the female, we will directly plate them onto modified cyan media, which means this pathogen is a fastidious bacteria. Because the female's vagina tract, there is a lots of normal bacteria, especially lactic acid bacteria. It will be bothered if you do gram stem. So we skip the gram stem steps. And lots of the time where we do the test is called PID, pyruvate inflammatory disease. That is a result from infection of vertebral tubes and surrounding tissues. And it could be some decimated gonorrhea infection from the joints, heart, and the throat, which means it's very invasive. Now, how we do a diagnose? We do gram stem oxidase test. We mentioned the colony morphology and DNA probe test. Now, what we should do the treatments. Actually, to be honest, there is not many very good treatment. We can do, certainly we can do antibiotic therapy, and the penicillin resistance is very common because we use that too much. So I tell you, it's not a good way to do. We have to use antibiotics, but the resistance happens all the time. So for the gonorrhea, more important is public education and treatment of asymptomatic individuals, condom use during sexual activity, and a quick diagnosis and treatment of infectious individuals. So the prevention education is more important compared to the treatment. Now, syphilis caused by the spiral sheets. Okay, that's a very special bacteria called Treponema pallidum, subspecies pallidum. Most of the time we talk about syphilis is sexual transmitted. We call it a venereal syphilis, but sometimes a newborn baby also will get syphilis. We call it a congenital syphilis acquired in urethra. So that's, and I want to let you know. The second one is not through sexual activity. Now the syphilis, we mentioned there is a three stage. There is a little bit of difference between what I mentioned in the slides and I'm drawing on the blackboard, but basically they're the same. Just different textbook talk about different story. So the first one is the primary stage. We call it a chancre. Chancre, this is a word coming from French. You will see the penis will have a small painless and redness, red ulcer. Okay, that means it's infected with parasites. This is the first stage. The second stage is the whole body. You will see like a picture B. The whole body you will see is like a rash. It's a variable skin rash followed by the latent period. So that's called gumor. Actually, that is called gumor. Now here, this is the third stage have a gumor. It's okay, but I tell you, the second stage had a gumor. Now it's very tricky is that when they move to the gumor stage, some people think you have a skin problem because the chancre is disappeared. So they think, oh, okay, it's disappeared. We're gonna go in, we are fine. We can still continue to do the sexual activity. That causes further contaminants and infections. Okay, now the last stage here, they say the tertiary stage, which is formation of gumors. You will see the degenerative lesions happens in the skin, bone, and nervous system. Because later on stage of the syphilis, it will have a neurological symptoms and cardiovascular symptoms, which means it will be invaded, go to the neural system, and go to the heart. So it's very dangerous, it's very invasive. And the syphilis, it could be very long time. The third stage, that could be as long as 30 years and 30 years and you never, some people even move to the third stage, will be there for 30 years and never have a problem. It's a very dangerous situation. So I just want to let you know, these type of the disease, more important is the called in use and also the self and the public health education. It's more important than treatments. Now, clinically, how you could do the diagnosis, we mentioned that we could get a sample, let's say the lesion samples, we can do the microscopic exam. Basically, we use dark field microscope. We want to see the spiral sheets. Now, we can do the antibiotic, but more effective in the early stage. If you move on to the later stage, you're not going to be solve the problem. Or also, there is a concern for the antibiotic resistant. And the last one I mentioned a couple of times already, it's more important is education and the prevention. Okay, that's for syphilis. The last one is a Lyme disease. Lyme disease, it's another example of spiral sheets. Now, so what happened is this is happening in 1972 in Connecticut area, New England area. You see here is all very, very red. This is a high risk area. This coming in Connecticut, in the Lyme County in 1972. And the scientist named Bogdo, he is from Montana State University. He is the first person to identify this one. It is looks like asexual filaments, endoflagella, and no cell wall structure. So we have to do this under a dark field microscope. This is called Borrelia burgdorferi. This pathogen, this spiral sheets, causes Lyme disease. Now, what is the major symptoms of Lyme disease? You will see this arm, which is a target rash, or we say bull eye rash, like a bull eye. This is a very typical symptoms for the Lyme disease. And the Lyme disease, anybody who's like to do the aquatic activity like deep ocean or marine ocean fishing or diving, you have to do a screening test every 2 years. It's very easy to get Lyme disease. Now, it's very interesting. Lyme disease, actually where it comes from. The more important, we have to control this guy. This is Isodex ticks. Control ticks is number one because it's a 2 year program. Originally is a larva, then they find a mice, then they go to a leaf, and it's very important in the aggressive stage, the larva will be melted into a nymph. That stage is on a ticks. And then the ticks, Isodex ticks have a bites, go to the human being, it will cause a problem. And then the human being have a fecal sample contaminated by the mice, go to the deer, and they finally find another ticks. So in this 2 year program, you will see that 3 stages happened by the ticks. So the ticks, especially the Isodex ticks control, is number one to control the Lyme disease, and they widely existing in the marine ocean or some of the river area. Okay, that's number one, because you know there's no way you're going to kill all the mice and all the deer. So the ticks control, Isodex ticks control is most important. Okay, here are some of the pictures for the Borrelia burgdorferi, asexual filaments, no rarely flagella. It's endoflagella have the movement, and the flagella is composed by flagellin, which is a protein. They do these 9.2. We call it 9+2 construction. They can do this real movement, which is called the rotation. Okay, so that is something very simple for the Lyme disease. Now, how are we going to do the diagnosis? Serological testing, ELISA Western blot. We do the PCR test. We know the PCR test has been doing a lot for COVID-19, is that right? So we also do a PCR test. Isolate the spiral sheets from the patient to do the observation underneath dark field microscope. Now, what's the way to do the treatment? Of course, antibiotics in the early stage. But more important is tick control and avoiding ticks. Okay, so by the end of here, we are finishing talking about all 3 lectures, talk about the human disease caused by the bacteria. And I will be put on the eCampus. I think about the 3 sets of the fact sheets you can go ahead to read. I find something on the textbook and I combined all of them and write myself so you can read it. And I'm also going to be moved on to our last lecture, which is antibiotic, where we'll be talking about on Zoom, and also we'll be have a YouTube channel post from the YouTube I draw on the blackboard. So next week, October 13th, October 15th, that week, I will postpone the exam 2 on the eCampus, and same as exam 1. It's open book, try 3 times. But we will have lots of the case study. So please do read all the YouTube channel videos, or the Zoom videos, slides, and also especially the new fact sheets, what I put on the eCampus. So thank you very much. And we will stop here. Then we go to talk about antibiotics in the next section. Thank you.